Chapter 6, Part 2. We'll continue with the skeletal system, types of bones based on shape. We have longer bones, so the leg, femur, tibia, fibula, arm and hand, so the humerus, radius, ulna, and phalanges, which is our fingers. Short bones, which is carpals, wrist and tarsals, and our tarsals are in our feet, and the ankle. We have flat, several cranial bones, ribs, and scapula. Irregular, so the cranial bones, the sphenoid and sphenoid, vertebral column, vertebrae, sacrum, and coccyx, connected by joints that permit flexion, extension, abduction, which is away from the midline or away from the body, adduction, which is toward the median, rotation, and combination of these movements. The inflammatory condition, so osteoarthritis and bursitis, is an inflammation of the bone. Gout, sclerosis, and rickets. Bacterial infections, so osteomyelitis, are the inflammation of the bone. This is commonly seen in finger sticks in infants that are less than 1 year of age because the likelihood of the lancet hitting the bone is extremely high. Osteoporosis, which is porous bone conditions. Fractures or tumors, developmental conditions, so giantism and dwarfism. This is conditions affecting the skeletal system. This is an X-ray of osteoarthritis joint changes. As you can see, the joints start curving and turning inwards as opposed to being straight. This is the condition, this is gout of the finger joint. Gout is also commonly seen in the big toe, but the joints would swell up as shown in image 6/16 in your book. This is open fracture of the wrist, where you can see the bone is sticking out of the skin. This is what's called a open fracture, which means the bone is clearly broken, whereas opposed to a closed fracture, where the bone might just be chipped. Skeletal system laboratory tests. We might test for calcium, phosphate levels, uric acid, vitamin D, alkaline phosphatase, anti-nuclear antibodies, or ANA, erythrocyte sedimentation rate, ASR, complete blood cells, CBC counts, microbial cultures of the bone marrow, or synovial fluid. There's 3 types of muscles. They're skeletal, cardiac, and smooth. The types of muscles, so skeletal, it's a striated voluntary. It's attached to bones. Visceral, non-striated or smooth and voluntary, lining walls of internal structures such as veins and arteries, and the cardiac, which is striated involuntary parts. So voluntary versus involuntary. Voluntary would have to physically move the arm to get the muscle to work, where a cardiac, we don't think about our heart beating. It's an involuntary reaction. Muscular system, so movement, maintains posture, produces heat, and glycogen is stored glucose in the muscles. And figure 6/18 shows the muscular system. Muscle system disorders, so there's muscular dystrophy, MD, multiple sclerosis, MS, and ALS. Muscle cramps, tendinitis, and accidents. Muscle atrophy due to inactivity. This is commonly seen when we've had an injury to an area and then we stop using that particular limb. Viral infections, poliomyelitis, and most of these also affect the nervous system because they're closely intertwined. Muscle enzymes, so we can detect heart enzymes, analysis of autoimmune antibodies, microscopic examination, and culturing of the biopsy tissue. Nervous system, this is communication, so sensation, thoughts, emotions, and memories. Sensory neurons transmit nerve impulses to spinal cord or to the brain from muscle tissues. Motor neurons transmit impulses to muscles from the spinal cord to the brain. This is the organization of the nervous system. I will have you review figure 6/19 on your own. Nervous system, so there's neurons, the brain, the spinal cord, the brain and spinal cord coverings, or the meninges, and cerebral spinal fluid. Central nervous system, the brain, spinal cord, brain, and cord coverings and fluid. The peripheral nervous system, which is a network outside the brain and spinal cord, including nerve cells, neurons, and the nerve impulse itself. Autonomic nervous system, this controls glands, blood vessels, viscera, and genitalia. Infectious conditions: encephalitis, meningitis, poliomyelitis, ALS, MS, and Parkinson's disease or cerebral palsy. We will see how we accommodate for these conditions as well when it comes to nervous system disorders. We see Parkinson's disease more commonly in the geriatric population, and there's ways to help when they have tremors to draw their blood safely and appropriately. Tumors, epilepsy, hydrocephaly, headaches, injuries resulting in paralysis as well. Figure 6/20 is the nervous system broken down. Conditions affecting the nervous system: sometimes it can affect from the neck down. Sometimes it affects just one side of our body. Other times it could affect just the lower half of the body. So, nervous system laboratory testing. Chemical analysis can reveal drug interactions such as well as hormonal, protein, and enzyme alterations. Infections detected by bacterial, viral, or fungal cultures or by the presence of specific antibodies or proteins. Analysis often includes cerebrospinal fluid. They will look at this if they suspect the patient might be coming in with signs and symptoms of meningitis. Respiratory system. Respiration allows for exchange of gases between blood and air. Figure 6/22 is the respiratory system, and it breaks down the main components, starting with our pharynx. The nose, primary filter for air entering the body. The pharynx, tube-like passage for food and air. Trachea, larynx, and bronchi, passages for outside air to reach lungs. Larynx has vocal cords. There is 3 lobes on our right side, and the left lung has only 2. It allows for space for the heart. Red blood cells transport oxygen and CO2 via hemoglobin. Different types of infections of the respiratory system include tuberculosis, laryngitis, bronchitis, cold, sore throats, whooping cough, and tonsillitis. When we look at the itises, this is that suffix we were talking about. This is inflammation. And then our root would be the beginning piece. Whooping cough is commonly seen, and we worry about this more in our newborns. This slide continues with the infection of the respiratory system. I will have you review this on your own. Other ones we might see patients coming in with when we go to draw their blood is influenza and pneumonia. Influenza we would swab for to determine if they have active flu virus. Conditions such as asthma, emphysema, and cystic fibrosis and tumors are just some common disorders of the respiratory system. This figure 6/23 shows you constricted bronchiola and then what's considered normal. Blood gases and blood pH are common laboratory tests used for the respiratory system. Chemical constitutes, so we might look at the sodium chloride, bicarbonate, and potassium. We could also do biopsies, throat swabs, sputum cultures. Bronchial washes can be examined microscopically or cultured for pathogenic microorganisms. The digestive system. This breaks down food chemically and physically into nutrients. The wave-like movement of food through the intestines is how our food passes from each phase in our digestive system and eliminates waste products of digestion. The gastrointestinal GI tract is made up of the mouth and teeth, the pharynx, the esophagus, the stomach, the small and large intestine, and also the salivary glands, liver, gallbladder, pancreas, and appendix. Figure 6/24 gives you a visual image of those organs. Disorders of the digestive system include dental caries and periodontal disease, stomach disorders such as GERD, gastroesophageal reflux disease, hiatal hernias, protrusion through the diaphragm, irritable bowel syndrome, vomiting, H. pylori, which we will cover in our class and run testing for, and pelvic ulcer disease. Intestinal disorders, there could be polyps, maldigestion, malabsorption, cancer, and appendicitis, which is the inflammation of the appendix, which requires removal. There's also constipation, diarrhea, hemorrhoids, and pancreatitis. Liver inflammation, hepatitis, alcoholism, and cancer gallstones, and bacterial or parasitic infections, which would include staphylococcal food poisoning, salmonella, typhoid fever, cholera, Jardinarius, tapeworms, pinworms, hookworms, and roundworms. So the digestive system laboratory tests include tissue biopsies, occult blood tests, which we will cover in our non-blood specimens in our phlebotomy course, bacterial cultures, analysis for overrun parasites, gastric analysis, and chemical analysis on blood samples. Again, this will be covered in detail in Chapter 16 in our phlebotomy handbook. The urinary system, we have 2 kidneys, 2 ureters, a bladder, and urethra. The urinary system regulates water, electrolytes, homeostasis, eliminates urine waste products, and maintains acid-base balance. The normal ratio to acid is 1 to 20. Blood pH and blood gases determinations provide information about acid-base balance in the body. Normal blood pH is 7.35 to 7.45. Figure 6/25 gives you the detailed diagram of what the urinary system looks like, as well as the kidney, the renal tubula. Disorders of the urinary system: acidosis, blood pH less than 7.35. Alkalosis, my apologies, blood pH more than 7.45. Nephrotic syndrome, cancers and diabetes. Acute or chronic kidney disease. End-stage renal disease. Glomerulonephritis. Urine dipstick or blood levels, which we will complete urine dipsticks in our course. Microbiologic analysis of blood or urine. Chemical analysis, so we might look at the albumin ammonia bun, which is blood urea nitrogen, blood pH, blood gases, and lights. We would also look at the glomerular filtration rate, osmolarity. Creatinine clearance evaluates the degree to which kidneys are filtering out waste. Figure 6/27 covers the endocrine glands and their hormones. We will talk about the thyroid gland as we look at thyroid levels in patients, the functions of the pancreas, exocrine glands, so secrete fluids, so sweat, saliva, mucus, and digestive juices. The endocrine glands are ductless glands. Hormones go directly into the bloodstream. This is the hypothalamus, pituitary, thyroid, and parathyroid, thymus, adrenal glands, ovaries, and testes. Disorders of the endocrine system: the many inherited hormonal disorders such as Addison's disease, dwarfism, giantism, acromegaly, tumors, hyper and hypothyroidism, diabetes insipidus or mellitus, and goiters. So some common laboratory tests: chemical analysis for many constitutes regulated by the endocrine system, so glucose, insulin, renin, serotonin, erythropoietin, and cortisol, and specific thyroid function tests. The reproductive system: males, there's the testes, seminal vesicle, prostate gland, epididymis, ejaculatory ducts, urethra, the penis, and spermatic cords. Primary functions: to secrete hormones, spermatogenesis, sperm storage, and ejaculation. In females, there's the ovaries, fallopian tubes, uterus, vagina, labia, breast, and mammary glands, and their primary function as listed here for ovulation, fertilization, menstruation, pregnancy, labor, and lactation, and secretion of hormones. Disorders of the reproductive system include malignant tumors, cysts, STDs, including HIV and infertility. Fertility test is a laboratory test we can perform. This is semen analysis, anti-sperm antibodies, and hormone analysis, cryogenic analysis, and tissue biopsies. Pap smears, microbiological and viral cultures of the infected areas, blood or urine tests. A lot of these will be covered in our continued process throughout the Phlebotomy 101 course. This will conclude Chapter 6, Part 2. Please view this prior to class to prepare for the instructor's lecture.